Hi, I'm Angela Lucas. I'm a social worker with the VA, and I'm going to discuss intimacy and dementia today. So intimacy, we often think of it just as sexuality, but it's actually more than that. It's actually more of a connection. It's a need for physical and emotional closeness. So when you think about intimacy, again, we think about sexuality, but most of us have an intimate friend that we stand and share secrets with and whisper to. So there's that kind of connection as well. There's also a lot of benefits to intimacy. There's psychological benefits, quality of life, increased intimacy, better health, and longevity. And all of that sounds very fancy, but basically what it's saying is when we're connected to other people, we benefit from that in all areas of our life. So what are the changes that we begin to see when somebody has dementia? So we can see a diminished interest. We can see a loss of inhibition. We can see sexualized behaviors. And those things become very problematic. So how does it really affect it? So when somebody has a cognitive impairment, we see a big deterioration, not only in their intimacy issues or connections, but in all areas. But intimacy becomes a big problem. So we start seeing a disturbance in their memory, personality changes, physical issues related to the disease process, and issues with impulse control. That's the biggie. The impulse control really gets us in trouble. And so when we start thinking about cognitive impairment and deterioration, it really comes down to what part of the brain is most affected. So when we think about the frontal lobe, that's at the front part of the brain, that is what impairs judgment and insight. So that may be why somebody goes into Walmart and they look at the clerk and say, wow, you have some really big whatever, put in what you would like to say there. And it just mortifies the caregiver. They just want to crawl through the floor. So you may also see an increased need for intimacy or sexuality, or maybe a decrease. People that have maybe had an active sex life that suddenly they don't have an interest anymore. That's not as problematic as the other areas are. So what is an inappropriate sexual behavior? It's a specific sexual behavior that's marked by an apparent loss of control, of intimacy seeking, misplaced in the social context, or directed towards the wrong target behavior. It may not be sexual in form, but in its suggestion. So again, I can think of a specific example. When my uncle had dementia, he came next door one day and stood and put his hand on his hip and became very flirty with me. And I was like, oh my God, it kind of gave me the creeps for a second there because I was not comfortable with it. But I wasn't even a social worker at that point in time. I was in college. So once I kind of realized what was going on, talked to my mom about it, and we kind of addressed it in a different way. And just, I would be very careful what I was wearing when I was around him. I've had some children or grandchildren that the granddad made an actual pass at her. And it was very upsetting to her. So what can inappropriate sexual behaviors be? So again, it can be comments. It can actually be touching. It can be suggestions. One caregiver that I had, the daughter said that her dad came in one day and took her by the hand. She was sitting in the chair and she says, what are we going to do? And he says, we're going to go have sex. And she was just freaked out. So again, there's things that we can do to address this and redirect the behavior. So it may be something also that may come up is maybe masturbating, undressing in the room with other people. It can be implied sexual acts. Again, it may be that they're watching pornography. So my colleague and I went to a veteran's home one day to do a visit, and we separated out. And so the nurse goes into the room that he's in with him, and up on the screen is a pornographic film that's going on. So she was like, oh my gosh. So he says, oh my goodness. So he realized it and turned it off. And so just that judgment, normally he might have watched that in the past, but he would have never done that with somebody coming into his home. So again, Another big problem that we sometimes have is with the whole memory issue. So sometimes they may forget that they've had sex. They may even forget who the caregiver is. So when they don't recognize you as the wife, what do? So you will often have caregivers whose husbands don't want to be in the same room with them by themselves because they're afraid that their wife would become upset. There can be some of the reasons for this may also be that there could be delirium. There can be physical changes that are going on. They may forget that they've had sex. They may forget that they can't have sex anymore. So these are some of the things that can surface with the judgment and memory piece of things. So again, coming back to the whole disorientation piece where you don't recognize your partner, not only is that upsetting to your partner, but one caregiver shared with me recently that her husband woke up and was like, "Who are you? Did you stay here all night? Oh my goodness, I'm married." And oh my goodness. So he's kind of going through this whole gamut, and he was very confused for the first few minutes. And she said, "Well, that's okay. You told me it'd be okay for me to stay last night, and so I did. And we're going to go have some breakfast now." So she just handled it very gracefully and very, very sweetly, and did not put him off. But it can be very frightening to that person if they don't recognize their loved one. Another caregiver has shared that when her husband does not recognize her, she actually has to leave her home and either go next door to his brother's house or sit on the porch. So we'll come up with some strategies of some things that we've done, but I'll go ahead and insert this one now. I suggested that we do a note so that she can say, "Oh, Sally Jane asked me to stay here until she returned," rather than arguing with him that she's not the wife or that she is the wife. So what are some things that can actually trigger issues? So sometimes it can be past abuse. So sometimes we're seeing with veterans, and it's not just limited to veterans, but with individuals, there may be a history of sexual abuse to them. There may be some trauma in general. There can be things that we had no idea about, nor that their spouse knows about or their caregiver knows about. There may be previous relationships. They may have been married before to someone else or had a long-term relationship that kind of interferes suddenly, that helps them not to recognize their partner anymore, or have some unusual thoughts and feelings about having intimacy with someone. There can be issues within their current marriage. An example of that is maybe the partner that has dementia had stepped out before. And so there's all this history between the husband and wife, or the two spouses, that are explosive in nature, because maybe one of them had an affair and suddenly all of this is surfacing or resurfacing. Maybe he's wanting to have sex and she hasn't wanted to have sex with him in years because he had an affair, or vice versa. So there's a lot of secrecy. There can also be a lot of accusations during this time. Well, if you're not having sex with me, who are you having sex with? And also a new development that's more talked about now is sexual orientation. So maybe you have someone that has never had a homosexual experience that we know about, but maybe they experimented in college, and some of these things are coming back to them now. It's not that that's wrong, but maybe the spouse did not know. So next, we're going to kind of get into how dementia affects ISB. So the big takeaway here is what doesn't change. And the person with dementia still needs and desires intimacy and affection. So what are some triggers for ISB behaviors? So boredom. So if someone is sitting there and they have nothing to do, nothing better to do whatsoever, they become bored. So they may begin to pick at their clothes. They may begin to take off their pants. They may reach over to someone else and grab them. They may feel lonely or isolated. So one particular caregiver that I used to have, what she would do, she was like the little Energizer bunny. So she would go to the back of the house and come back constantly. So her husband would be sitting in the chair. So she would come by and kiss him on the head, kiss him on the cheek, just so she stayed connected and he didn't have to get up and go look for her. Sometimes it can be anxiety. Again, if they're in the other room, I'm here by myself. Where did you go? Where's my wife? Because they're the lifeline. The caregiver is the lifeline for someone living with dementia. There can be environmental things. So again, monitoring what's on television. Certainly this day and time, a lot of the commercials are way more sexual in nature than anything that we've ever seen before. But those things can actually trigger thoughts or stimulate a thought or an action. Another big issue can be medical considerations. So if you have someone that has a UTI, again, they get into delirium, so you may see more acting out and more behaviors. You may also, if someone needs to go to the bathroom, maybe they can't verbalize anymore, they begin to pull at themselves. So it's not really sexual in nature. It's more about wanting to get this diaper off of me or this pull-up off of me because it's wet and it's soiled and I don't want it on me anymore. But with all of that, when you have someone that is making inappropriate comments, what happens? People begin to get embarrassed, they get shunned, they get shamed, and people want to avoid them. If your spouse is making inappropriate comments every time I come over to your house, I'm probably not going to come to your house very much. So what can you do? A lot of times you can kind of involve. So an example of this is I had one caregiver whose husband had made some inappropriate comments. I'm not really sure what was said, but he made an inappropriate comment to someone that they socialized with through church. And so that person went to the minister. The minister involved the board. So this whole big collective group of people got together. So their first reaction was, well, he can't come to church anymore. And the person that he made the comment to said, we can't do that. Because if we do that, that means Sally Jane can't come to church anymore. And she needs us. She needs that connection. So what they came up with on a collective group, which I thought was just beautiful, was that each Sunday, again, prior to COVID, different members would come up and they'd start here as soon as the church service was over and they'd walk him through and get him out the door without a lot of inappropriate comments to other women. So what do you do to cope? So we can't deny that people are sexual beings and the need for intimacy. We just can't deny that. But we have to figure out a way to redirect it, and we want to have them have dignity and for them to be safe and the people around them to be safe. So it's not about the sexual need. A lot of times, again, it can be the boredom. It can be they're just upset or anxious about something that has nothing to do with sex, but they don't know how to express it. So we do a lot of reassurance and acceptance. We're not accepting the behavior, but we're just reassuring them. We're giving them something to do, something to look forward to, maybe going on a ride. Okay, finish eating your breakfast and we'll go for a ride. Being mindful about people coming into your home. So for many of our veterans, they have aides that come into their home. So not that you want to tell somebody how to dress, but if they're coming in because their top is a little lower cut, maybe having them make sure that they pull that on differently when they're working with them, or being mindful of what they say when they ask them to go to the bathroom to get into the shower. Because again, you've got a female that's coming in and asking a male to get into the shower. They may think that they're going to get in there with them. So just being mindful about how we can structure things differently because they can't. So redirection, we want to use some distraction. So again, looking at giving them something appropriate to do with their hands. If they're playing with themselves, giving them something to do, giving them a puzzle to do. Come over here and let's sit down and do this. Calling somebody up and having them come over for a quick visit. Any kind of distraction often works to reframe or refocus the person and help them not to be as distracted. Therapeutic fibbing. So a lot of people will really think this is funny, especially if you're older. We have the thought of the women can look at the guys and say, you know what? We had sex last night and it was very good. I can't have sex again tonight. I'm just too tired. Or I can't have sex tonight because I'm on my period. Or the children might hear us, or whatever it is, so that you're doing a little therapeutic fib. And it's kind of a little white lie, but it's okay. You know, thinking back to the old movies, not tonight, honey, I have a headache. Provide a new activity. Again, taking them for a ride. I've got one caregiver that every day they go for a ride. Her husband, she came to caregiver support group one day, and she had not been in a while, and she and her daughter came in, and she was just mortified to even discuss this issue. And she said her husband had started doing all this touching and grabbing and coming by and popping her on the butt or grabbing her breast, things that just was totally out of character for him, and not the way their relationship had ever been. So we had to come up with ideas and strategies. So kind of also normalizing it to the person that's experiencing it. If you have a caregiver that is experiencing this, what they perceive as a trauma issue almost, because it's embarrassing, it's not something you want to talk to your best friend about, that your husband's wanting to pull off his clothes. So providing reassurance to him, checking for medical or personal needs. First thing, is he hungry? Is he or she wet? Is the room temperature too hot? So doing some environmental checks to see if there's something that we can do. So strategies for coping. Again, being mindful that you're not alone, joining some support groups, talking to friends, talking to your loved one's physician, alerting them to what's going on, providing reassurance to them, and also getting support, again, having somebody come over that gives you a break so that you have an opportunity to get out and not be stuck there. Warn people that are coming over so that they're not feeling so isolated and so alone. Call a family friend, call a neighbor and ask them to walk over. Because again, if they see something new or something different, a lot of times the behaviors will stop or minimize. So kind of the takeaway is that I want everybody to remember again that no one doesn't need closeness or touch. So you may do something as simple as a hand massage, rubbing their back, a kiss on the cheek, just sitting and holding hands, going for a walk, but something to stay connected. So a couple of other things that people are challenged with is what happens when your loved one can't be at home anymore. So maybe they need to go to an assisted living or to a nursing home. So a lot of times with facilities, they're not real keen on somebody undressing and coming out of the room or trying to go into another patient's room. So what do you do? So again, working with the staff there to come up with ideas and strategies to redirect the behavior. But a big problem that can sometimes happen, and this happened with a good friend of mine, his mother was placed in a facility. His dad is deceased, and his mother was there, and another family member's dad was there. And his mother and this gentleman became intimate. And so the nursing home was just appalled. They were so upset. They were so afraid to call my friend and share this with him and the other family. So they ended up having a big come to Jesus meeting, if you will. And the family of the male and my friend's family were all okay with it. So they actually let them move into the same room. But again, that's not for everybody. Some people are not going to feel comfortable with that. And it's not a judgment on my part on which way you should do or which way you shouldn't do. But these are some strategies or some challenges that sometimes people face and some options to do. So there's been some other examples of people wanting to keep them apart, and it just becomes very problematic and very sad. So being able to sort through our own issues with that. Another area that we struggle with sometimes is if we're the female, we may not want to have sex anymore. There may be some struggles there. So giving your partner permission to self-pleasure can sometimes be a good benefit. An area that is often overlooked, the last time I did this presentation, it was pointed out to me that it's not all males, that sometimes females are also very interested in having sex. So what can you do? So most of these strategies will still work even with females. But again, if you're comfortable and you're willing to purchasing toys that the female can use, especially if they're in a facility or at home, sharing with them that it's okay for them to do it. Again, the big takeaway here is obviously they can't do this in a public setting. They can't do this when the minister comes over to visit at the house or the next door neighbor's coming over. They can't do it at the next door neighbor's house. So we're not wanting to squelch their desire for intimacy or connection or closeness. We do want to reframe it and redirect it to the right place. Another thought that I have is the embarrassment that caregivers often have. They feel very isolated and very alone because they're not quite sure. The person that they loved, they really, even if they had been being intimate with, they no longer want to be intimate with them because there's just so many changes, there's risk. We also can get into a little bit of an ethical quagmire here, is can the person actually give permission to have sex? So if you are married or connected to that person and you want to have sex with them, can you still do that safely if they don't recognize who you are? So anyway, thank you very much for your time.